Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we have experts from around the country discussing longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited today to have Dr. Deanna Cherrone on with me. She found that the one-size-fits-all approach to treatment in conventional medicine often failed to adequately search for and address the underlying cause of symptoms in herself and in her patients. For this reason, she became certified in functional medicine and opened her practice, Natural Health and Healing, in Connecticut over 18 years ago. She loves educating patients on how to take charge of their health. The functional medicine approach and testing allows her to look at each patient's unique biochemistry in the context of their physical, mental, and emotional health and well-being. With this information, she dispenses personalized therapies that can have lifelong effects. Her therapeutic lifestyle change, attention to details, support, and guidance equips patients with the tools needed to reduce or alleviate symptoms, decrease the likelihood of developing disease, and improve or even resolve current disease states. And you can learn more about her at her website, which is www.naturalhealthandhealing.net. So welcome, Dr. Cherrone. How are you today?
I'm doing great, Diane. Thank you so much. So nice to be here with you.
Yeah, awesome. So we go way back. Deanna was one of my first advertisers in my magazine here in Connecticut. That's how we met. And I was very intrigued that she was an MD, medical doctor, that had actually, decided to make a huge change and focus her practice on functional medicine and integrative medicine. So I kind of wanted to start there. We're going to talk a lot about one of the things you're passionate about right now is helping people with cognitive decline and all different things related to risk factors and natural therapies. But I wanted to start by giving our listeners kind of insight into why an MD would decide to, kind of walk away from the more traditional aspect of practicing and take this leap into what you're doing. Because now I think there's more and more of you around, but back when we met, there were very few integrative medical doctors.
Yeah, that's correct. I remember when I went into my first functional medicine training, there were probably less than 100 of us. And now when I go to the annual meetings, there's thousands of us in the room. So it really has burgeoned over the years, which is great, because I think for me, when I stepped out of my internal medicine practice when I had children, and then was really dreading going back into practice. I said to my husband, I just don't want to have to see 25 patients a day and, herd them in and out like cattle and really not address the underlying issues and just writing out prescriptions that are Band-Aids for patients' symptoms and diseases. So, I felt really unfulfilled. I felt that the patients weren't fulfilled after, just seeing me for a short 5 to 10 minute visit. And I actually, through my own, I didn't have any significant, health challenges, but they were affecting my daily life in terms of sleep and headaches and stomach gut issues. And so I ended up seeing a doctor and who practiced functional medicine. And when I was there, she suggested that I see this nutritionist. And the nutritionist said to me, when she asked me what I was passionate about. And I said, I love teaching people about health and how to prevent disease. And she said, you really should look into this conference called Food is Medicine. And I was just really intrigued by the concept. And so I went home, I looked it up. And at the time I had 2 boys that were, I think, 3 and 5. And I said to my husband, this looks really, really fascinating. And I had just given my notice at my job because I really couldn't continue the pace. And they basically wanted me to work for 3 months without pay because I wasn't meeting my quota in terms of the number of patients that they wanted seen. So long story short is I ended up going to this conference. It opened my world up to functional medicine. I started doing the functional medicine training and lots of other trainings, that just complemented that practice. And it's just been an amazing journey for me as a physician, because I feel like I'm really going back to all the biochemistry and physiology that we basically just kind of push to the side and say, oh, what drug can I prescribe for this condition? So it's been really transformative for me personally and professionally. And I really feel like I'm able to help patients in ways that I never was just writing out prescriptions.
Yeah, I mean, it's really inspiring, and also I think, um, you had to really take a leap of faith in doing what you're doing, and it's, go back and basically like learn all this new information and new way to practice. And I think a lot of doctors are either just afraid to do that, or they just don't have the ability to do it, the time or the money, or whatever it might be, and they're kind of stuck where they are. So I think it's great that you did that, and we definitely need more of you. And it's good to hear that it's, now there's thousands in the room versus 100. So that's
Exactly.
awesome. So you do a whole plethora of things. I know for years you were very passionate about hormones and hormonal regulation, and more recently you've gotten into a lot more learning about cognitive decline and the things that start to happen. Like, why are we seeing so much dementia and Alzheimer's and all of that? So I wanted to focus this show with you on the things that you're learning, how you can educate us on basically taking care of our brain health, which is so important. So I have a bunch of different questions for you. I think probably where we'll start is, what should people be looking for? Like, what are the common early signs and symptoms of cognitive decline? And then maybe we can talk about, what does cognitive decline even mean? Like, how does somebody know that's happening, and how do you explain that to a patient?
Yeah, I mean, I think, what comes to mind immediately is when we talk about those senior moments. And I remember one time my son, he's like, Mom, I'm having a junior moment. And I just cracked up because he couldn't remember, what he was wanting to tell me. And so it's that kind of thing. It's like, we're just not, we don't either can't find a word, or we have difficulty remembering a name, or we walk into a room and don't remember why we walked there, or we're misplacing things. Those are some of like the early signs. I remember one of the first conferences that I attended, and the doctor was kind of going through all the symptoms, and I was like, wow, I think I really need to start addressing this now. And I was in my 40s at the time. So in any event, there are a lot of things. I mean, I think that when we lose our train of thought in a conversation, have difficulty following instructions or finishing a task, even simple things like not being able to follow a football game that you used to be able to follow, or balance your checkbook, or those things start to get a little bit more, like, oh wow, something's not right. This is, my brain is not functioning the way that it had been. Doing simple math in your head, counting change. I mean, all these things. Sometimes, you start to notice, wow, I'm having difficulty with this. And I think in our world, it's easy for us to just pass it off as, oh, I'm overwhelmed, I'm stressed, I'm got so many things on my plate. And I do think that that definitely contributes. Multitasking is probably one of the worst things that we can do for our brain, and yet it's something that we kind
We
of
all
pride
do.
ourselves on
Yeah,
doing, right? Like the
exactly.
more we can do, the better. The more
Yep.
plates we have spinning in the air, the better. But it really isn't very good for our brains. So yeah, I think there are other things like vision problems and hearing problems and judging distances and balance. And again, these are kind of moving you further along the spectrum in terms of severity, but getting confused driving in places that are familiar with you, not remembering the date or the time. So, it's something that we can easily ignore. And I did a training with Dale Bredesen. He wrote, this is his older version, but The End of Alzheimer's. I did a certification with him. And in this book, he talks about how just like we do colonoscopies starting at age 50, he really believes that we should do something called a cognoscopy starting at age 45. And you would do those actually yearly, and then depending on the severity of the cognitive issues that you're having, we would do that testing more frequently.
So what is that test?
So
Because I've never heard of that, actually. That's fascinating.
yeah. So it's actually a combination of things. So there's a whole host of blood tests that we do in combination with it's called the MOCA, the Montreal Cognitive Assessment Test. And it's a 30-question test administered by, me or another healthcare provider. And basically it just, we go through it, takes about 10 to 12 minutes, and then you get a score, and that tells me, if you're normal or if you're struggling with cognitive decline. On Dr. Bredesen's website, he also has a CQ. It's a test that you can take, and it'll tell you whether or not he thinks you should go into their pre-code, preventing cognitive decline, or recode, which is reversing cognitive decline. And he's had some really great success in, with patients that have struggled with significant cognitive issues.
I think also, I'm just sitting here listening to you and I'm thinking, there's time to time where I'm like, oh, I forget, I'm trying to think of a word or maybe very minor things. Like I wouldn't think it was anything that I would need to follow up on. But it makes me think, why wouldn't we just take these precautions now anyway? I mean, why wouldn't we start doing things to help our brain health now? Just because of all the stuff that we're exposed to, the toxins in the environment, the way that we eat, how healthy or not healthy, or even if we're trying to eat healthy with just our food supply as it is, whether we take supplements or not, whether we act like even our lifestyle, I feel like it should be something that maybe we should all start thinking about, even if we aren't having any of that kind of like short-term memory issue.
Exactly. I couldn't agree more. And because of the environment and all the things that you mentioned, it is really a problem that is becoming more prevalent. We're seeing more and more cognitive decline. And what I love about Dr. Bredesen's, I've done the pre-code program with some patients and the recode program. And what's nice is it really lays out for you what are the factors that are driving cognitive decline for you, so that you can then take steps to make improvements in those areas. So whether it's having too much sugar in your diet or not enough exercise, again, it kind of lays out a personalized plan that can really help you start moving things in the right direction.
Yeah, and it seems pretty simple to do. So this is all fascinating. We're going to get into a lot more interesting discussion about how we can have better brain health, basically. You're listening to Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break now. When we come back, we'll explore more with Dr. Deanna Cherrone. Stay tuned. We'll be right back. We're back in the Dr. Diane show with me, Dr. Diane Hayden. And before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Deanna Cherrone at her website, which is www.naturalhealthandhealing.net. So welcome back, Dr. Cherrone. We were talking about just, cognitive decline, how to notice what some of the early signs are. And I was saying, really, if you're not even noticing early signs, I think just doing some of the things that you're going to talk about in being proactive about taking care of your brain is a good thing to do, because basically, what do we have if we don't have our brain health?
Exactly. Exactly.
So let's talk about risk factors. So, what are some risk factors associated with cognitive decline, such as Alzheimer's disease or other forms of dementia?
Yeah. So, I mean, it's something that we think about as we age, and it is sort of the primary cause. But there is also a genetic factor, or genetic factors, I should say, that can contribute. And we know that genes provide potential, but they aren't our destiny. So everything that we do in our life can determine whether a gene for Alzheimer's or dementia gets turned on, or whether that gene turns off. So things like physical inactivity, mental inactivity, social isolation, um, things like just your chronic disease, cardiovascular disease, diabetes. In fact, a lot of people call dementia type 3 diabetes because there is, a huge component around blood sugar regulation and how it impacts brain health adversely. We all know about, traumatic brain injury and concussion and all of that contributing to dementia. And then, you sort of alluded to earlier the toxins in our environment, and there are many neurotoxins, including things like pesticides, heavy metals like mercury, lead, cadmium, aluminum. Cadmium comes from smoking. Aluminum, a lot of our deodorants have aluminum in them, aluminum foil, aluminum pans. There's solvents and car exhausts and chlorine, even things like MSG can, really have a negative impact on the brain. I think another thing that is probably a huge contributor that we don't think about as much is sleep and stress. So sleep deprivation is really a problem, in terms of its impact on the brain. People with sleep apnea are going to, have potential more risk of dementia. And then stress, its impact on our, I mean, they liken stress to smoking a pack of cigarettes a day. And of course, smoking is going to increase your risk of dementia, as alcohol. I mean, there's really no amount of alcohol that is okay, because it can affect all parts of the brain. There are other things like hormone imbalances, so thyroid disease, low sex hormones, poor diet, you obviously talked about, and then poor gut health, which kind of goes along with that. And then there are toxins from things like mold exposure and Lyme disease exposure, and certain vitamin and mineral deficiencies that can also contribute. So there's really a whole host of things that, and that's why Dr. Bredesen in his book, he talks about how there's 36 different insults that can contribute to cognitive decline. And that's why we're never going to be able to create a pill that will address all 36 of those insults. And he even tried to see if he could study his method against some of the medications that they have. And basically, he was turned down, saying, we can't study a lifestyle program against a medication. It's just not what we do. And so, I mean, if you look at him online, there will be some people that say this is all quackery. But I will tell you that, what he says, and he's researched this for years, he is a neurologist and an MD. And so, he's really put together an amazing program that has had a lot of beneficial results for many people who are struggling with this issue.
Yeah, I think the genetic component is really interesting because as you're talking, I'm thinking about people that I know in my family, or and I'm sure many people are going to relate to this, whether they had a parent who has dementia or Alzheimer's, or in the example I'm going to give, interestingly enough, this is just a perfect example of genetics. Like my mother, for example, has probably smoked for 60 years and she's 90 and she's sharp as a tack. I mean, they've got to like give her more harder tests at the assisted living facility that she's at because she remembers everything that they're testing her when they come in, and they're like, okay, remember these three words, and then we're going to talk about something else. And she'll bang out the three words if they've had a 10-minute conversation. And it's just amazing. It's like, wow, how is that possible? Because when you think about, like, okay, you said smoking is a huge risk factor for that, but for whatever reason, her genetics didn't get turned on for that particular issue. And then when I think about my boyfriend's father who passed away from Alzheimer's, he's the classic person. I mean, he had sleep apnea, he had hearing difficulty, and as he got older and he retired, he pretty much just kind of lost interest in a lot of things. All he wanted to do was sit in front of the TV. He stopped socializing, and then the next thing you know, it seemed to progress so quickly. So it's just like you can't explain it, right? It's
I
just that
know. Yeah, and
it's just
that's
that
that's
genetic thing.
that's what makes genetics so, I believe really the wave of the future. Um, I practice something called functional genomics, and we really look at all of, well, not it's not with the intent of saying you have X% risk of this disease or that disease, but it's really understanding that genes code for enzymes that run all of the different metabolic processes in our body. So it'd be really interesting to look at your mom's genetics versus your, boyfriend's dad's genetics to see, is she detox? Is she, being exposed to things? My suspicion is that she's just able to detox things, even though she's smoking. Her detox pathways are running great, whereas his might have been more sluggish, and therefore, things were not moving through his body like they needed to. There is a particular gene called the ApoE4 gene. Um, and basically the risk associated with that is if you have a gene from each parent, which is a homozygous condition, you have a 60% increased risk of developing dementia. If you have one gene from one parent, that's called heterozygous, and about a 20 to 25% risk with that that condition. There's also, and then in people who don't have that ApoE4, I should say, they have about a 10 to 15% risk of dementia. So you can see that gene alone increases your risk. And I have patients who will come to me and say, I have this gene, what can I do? And so we start really working on all of these pieces of the puzzle, all of these insults that Dr. Bredesen mentions, and to help reduce their risk of developing this disease.
Yeah, as you're talking, I'm thinking to myself, one thing we might talk about this in this show. If we don't, we should definitely dedicate another show to it. But the power of your mindset and what you believe. And so, there's all kinds of studies that show, that looked at, let's say, patients who were told they had some, terminal disease, and how their mindset, accepted or didn't accept that. And all the people who basically accepted that died within like a year. I forget what this is. I'm not quoting it in the
Mhm.
actual study because I don't remember, but I do remember picking up on this. And the people who were like, no, that's not, I'm not buying into that. I'm not buying that I only have a year to live, actually ended up living much longer. And so the mindset around your genetics, I think, is another thing to really consider, because just because you have that gene, maybe from one parent or both parents, still doesn't mean it's going to happen.
Exactly. Yeah, I think you're spot on that. And And I think that's, that's a frailty of our system, our current medical system, is that we don't give people hope. We give them statistics and we say, oh, in this condition, your risk is such, and your risk of dying or your risk of getting dementia is, and we don't really give people hope. And, hope is really just what people need. And the mindset is so important. Yeah, I think, yeah, I couldn't agree with you more on that.
Yeah, and so you mentioned earlier, like, we've talked about genetic factors, we've talked about risk factors. What about, we're going to have to take a short break in a couple minutes, but I want to start talking about the lifestyle choices. So we just kind of briefly touched on this with mindset, but things such as diet, exercise, mental stimulation, how can all those things potentially reduce the risk of cognitive decline?
Yeah, so as I mentioned, Alzheimer's has been called type 3 diabetes. So there is a huge, component of diet and having too much sugar, too much processed food. It's unfortunately, I always say if I could wave a magic wand over my patients and have them eat the food that would be most health promoting, it would be food that comes directly from nature. So vegetables, fruit, nuts, seeds, animal proteins, whole grains, right? um, as opposed to these foods that are produced you know, in companies and are made with lots of flour and sugar and food additives, all of which really can contribute to cognitive decline. So yeah, I think the sugar piece just can't be stressed enough. Our brain is 60% fat, so we need healthy fats in our diet. And, you know, the diet is what provides that fat that allows us to, repair and recycle the neurons in our brain. And even our nerves are covered with a sheath called myelin that is made of fat. And our cells have a phospholipid membrane. So every cell has a membrane that's made of fat. And all of those components are made from the fats that we take in our diet. So that's why healthy fats are so, so important. And Dr. Bredesen generally recommends a ketogenic diet. And, I would say that, again, I go back to the no one size fits all, even when we talk about diet, because for someone that had significant cardiovascular disease, we might be, a little bit, again, we're going to do lots of healthy fats, moderate protein, and lower carbohydrates, but the balance of those macronutrients, we might, shift up a little bit so that there's not, such a preponderance of high fats, especially if we start to see numbers, moving in the wrong direction. I think the other comment I would make is that, if animals are eating the food that they're supposed to eat, so if cows are eating grass as opposed to being fed grains, their fat content is entirely different. So grass-fed beef is going to be a lot more healthy for us than, the beef that's raised in factory farms. Same can be said for other meats, pasture raised, chickens
Chickens.
and
Yep.
pork and, and the eggs from those hens are going to, when the animal is fed the right diet, it's going to be a healthier version for us to ingest.
Right. And there's a million documentaries out there now about why you should eat grass fed and pasture raised and, what does cage free really mean and all of that. So this is fascinating. We're going to get into a lot more. You're listening to the Dr. Diane show with me, Dr. Diane Hayden. We're going to take a quick break. When we come back, we'll be talking more about cognitive decline with Dr. Deanna Cherrone. Stay tuned. We'll be right back. We're back on the Dr. Diane show with me, Dr. Diane Hayden, and I am talking today with Dr. Deanna Cherrone. You can learn more about her at her website, www.naturalhealthandhealing.net. Before we broke, we were talking just about the different lifestyle um, choices that people should be cognizant of in terms of like diet and what we can do to actually promote better brain health and prevent kind of this decline that we're talking about. So you were one thing I just wanted to follow up on. You were talking about the different foods and things like that. When you say healthy fats, give us some examples, because I think people are just so afraid. We've been like so, had it beaten into our heads that fat is bad, and, it causes high cholesterol and all this stuff. But we're talking about, so people just like cut it out completely. But give some examples of what you consider healthy fats that you would want people to be incorporating into their diet for this.
Okay. Yeah. So as I met, we were talking about grass-fed beef, butter from grass-fed cows is healthy, eggs from pasture-raised hens, um, nuts and seeds, olive oil. Ideally, you're going to want extra virgin, first cold pressed. So the least processed of anything that you eat, the better, including olive oil, um, avocado. So those are some of the healthy fats. Wild caught fish. We have an acronym for the healthiest fish for fatty fish, SMASH, which is sardines, mackerel, anchovies, salmon, and herring. So yeah, so those are our healthiest fats. I would
That's
also like to go ahead.
No, finish.
I was going to say I would also just like to talk a little bit more about sugar because, I think that it's just it's so prevalent and it's just so bad for the brain. It's so prevalent in our diets and it's so bad for our brain. And I'm not talking about sugar just like sweet sugar, but flours and breads and pastas and things like that. And sugar's bad because it activates your brain's reward system and it makes people feel good. And the problem is that the more sugar you have, I mean, sugar is 8 times more addictive than cocaine. So we're always going to be, craving it. And the more we eat it, the more we crave it, the more tolerance we have, which means that we need more and more to get that same feel good response. And then, we have a sugar addiction. And the sugar can overstimulate the brain, make it hyperactive, could cause hyperactivity, neural excitation. So, hyperactive. I remember when one day my kids came home from school and they were like bouncing off the walls. And I was like, what did you eat today? And they said, oh, we had Oreo cookies. I'm like, what? So, of course, you know me, I go stomping up to the, the head of the school, at their in the kindergarten, and I'm like, what do you feed? Why are you feeding the children Oreo cookies? She's like, well, we pay attention to what they eat. And I said, well, what most of them will eat. And I said, yeah, but if you're giving them Oreo cookies and an orange, of course they're always going to choose the Oreo cookies. But if you give them a choice between an orange and an apple, well, then, you can see which one that they.
Exactly. Yeah. Not too
So,
difficult there.
right. And then, long-term exposure obviously is what causes the diabetes. It actually causes the brain to shrink. There are less neural networks, less connections. We can develop small vessel disease, which can lead to vascular dementia. When we have these damage to blood vessels, we have reduced oxygen flow. We have reduced blood flow. That means you're not getting as many nutrients to the brain cells as well. The brain cells can die, and that can contribute to the dementia. So, and then acutely, when you have, like I said, you can get hyperactive from having the sugar, but you also can get brain fog and anxiety and depression just because the sugar causes inflammation in the brain that changes the brain's chemicals, and those chemicals are what contribute to those symptoms of anxiety and depression.
Yeah, it's so fascinating. It's so interesting. Like, I'm sure there's people on this call that are listening that they're like, oh my God, I could never give up sugar. Like, I have to have my ice cream or my chocolate or whatever it is. I have to say, years ago, I was never like a huge sugar freak. Like, I was never one of those people that constantly had to have dessert or whatever. But I would have cake if there was cake there, or I would go get an ice cream in the summer, blah blah blah. And then I kind of just gradually, I don't know, maybe just got away from it after I learned more and more about, it's really not great for you at all, as you're saying and listing off all these, kind of cascade of events. And now, if I have something that has a lot of sugar in it, and if I eat, if I have a couple of bites or something like that, I'm fine. If I were to eat like a whole ice cream cone or even like a whole slice of cake, I feel sick. Like it's just amazing how my body has changed to not tolerate it anymore. And that just tells me, I'm like, wow, why do I feel sick? This definitely is not good for me. My body is telling me, no, I don't want it. And I think
Exactly.
that happens to that if people can get away from it, I think you'll find that that probably happens for most people.
Well, yeah, I mean, I have so many patients that tell me as they cut down on their sugar when they have it, as you say, they first of all they say it's so sweet they can't even eat as much, and when they do have it, they just don't feel as well. So I always say cheating is, it's great because it gives you information.
Mhm.
And you can always decide in any moment, oh, I'm going to cheat today. This is, my 50th wedding anniversary or whatever it is, and I'm going to deal with the consequences of it. Or you say, I'm going to have just a couple bites, like you said, and feel okay. And we have that choice. So cheating gives you the information to help you make decisions in the future.
Totally. So back to lifestyle choices. What about exercise? How is
Oh,
that impacting?
exercise is just so important. I mean, we're talking about vessel disease, right? And how diabetes can impact the vessels. So exercise increases blood flow, right? So we're getting more oxygen to the brain. We're getting more of the nutrients that we need to the brain. So that can improve memory and thinking. It also helps to improve those neural networks. We have a neural network for everything that we've experienced in our life. And, those connections are really important for, again, memory and learning. It improves attention span and focus, and it decreases inflammation. And we know that inflammation is really the driver of all disease in the body. So, there are some people that are exercise to an extreme, and I would say that they need to be extra cautious about making sure that they're getting enough of the nutrients that they need to kind of counterbalance that excessive exercise. In the end, it's all about balance. But we have athletes that really, their whole life there is around exercise. And fortunately for them, most of them have nutritionists and people that are kind of helping them make sure that they get the proper macronutrient and micronutrients in their diet. The other thing about exercise is that it stimulates growth factors that can affect the health of the brain cells, the blood vessels, and those neural connections. It improves mood and sleep, which, sleep is going to be another really important piece, as I mentioned, for cognitive decline. So exercise is, really great. I think in his book, he mentions 30 minutes 4 to 6 times per week. I mean, I'll say to patients, if you can't do 30 minutes in a row, then do 10 minutes 3 times during the day, if that's all you can get in. But you really want to schedule exercise into your daily routine. It's just that important for not only brain health, but, health, just your overall health in general.
And are you talking about, let's say, more like strength training or cardiovascular exercise, or can this simply be something as simple as walking?
Yeah, it can be. I think all forms of exercise, are increasing blood flow. Obviously, um, again, as I mentioned, sometimes we go to an excess that can be more problematic. But walking is great. Great exercise. Strength training, obviously, as we age, we start to lose muscle mass, so that becomes, really important. Um, to maintain and improve that muscle mass decline. So yeah.
Yeah. So basically, it's just moving the body in a way. I mean, what I would tell people is find something you like to do, because if it's going to be burdensome, then and you hate it, you're not going to do it. So find some form of exercise that you like to do: walking, swimming, yoga, Pilates, dance, anything,
Absolutely.
just as
Yeah.
long as you're moving the body.
Gardening. Yeah. I mean,
Yep.
yes, I say the same things to patients. It's really, some of my patients say, I clean my house. I'm going up and down the stairs, 20 times cleaning the house. And, it counts. All of it counts.
Oh yeah,
Um,
absolutely. What about mental stimulation? What
yeah. So
advice do you have for us?
again, brain most of us are using our brains, but as we
Retire.
age, as we retire, like you said, you're more socially isolated. I
Yep.
mean, he recommends a game called Brain HQ that has studies, behind it showing its efficacy. But anything like word puzzles, math, learning a new skill, so language or dancing, one of my friends told me she's learning line dancing, and she's like, it's so, it's really stressing my brain. I have to remember all the steps. And
That's good though.
yeah, it's great. And, no matter how old we are, learning new things are going to create those neural connections that, just make the brain more adaptable and more neuroplastic. And that's what we want. Even things like using all of your senses. So, if you're cooking something and you're just close your eyes and you just notice what you're smelling and what you're tasting and, how the food feels inside your mouth. Yeah, there are a lot of things that you can do that it doesn't require, I guess I should say, a lot on your part to really stimulate the brain. And of course, being socially active and, intellectual stimulation is great.
So Brain HQ, is that an app, or do you know where people would find it?
Yes, you can get it on your phone, you can get it online. If you were to sign up for Dr. Bredesen's program, is part of it comes free with your monthly subscription. So yeah, it's
That's cool. That's great. At my mom's assisted living, she's on the puzzle committee. Well, I don't even
well,
know if it's really a committee. I think it was kind of like a joke there, but because her and this other woman are doing like 500 to 1,000 piece puzzles, which
that's
is great. I
great.
mean, they'll sit there. Yeah, but now she's like, yeah, but I'm sitting for like 2 hours trying to find these puzzle pieces, and she's like, I should be up walking. I'm like, well, all right, you got to figure out how to balance it. But at least you're using your brain. I mean,
Right, right.
it is really great. It is really great. And I think it's amazing, like when people retire and you could see the difference in people that still are doing things and how how their health like fares versus people who just kind of sit and do nothing. So
Exactly.
so this is all fascinating. We're going to take another quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more about natural therapies for cognitive decline with Dr. Deanna Cherrone. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Deanna Cherrone about cognitive decline. And her website is www.naturalhealthandhealing.net. So we've been basically going through like a lot of the different lifestyle choices that people can make to prevent cognitive decline, what we can do as far as the way that we eat, our diet, exercise, including exercise into our daily lifestyle, mental stimulation, all of that. And you mentioned before, just briefly alluded to the fact that people who suffer from sleep apnea, that tends to progress cognitive decline more quickly. So what role does sleep play in all of this?
Yeah, so when we're sleep deprived, it actually damages a part of the brain called the hippocampus that's responsible for memory and learning. Um, and we can do MRIs where we add something called a neuroquant that actually shows us the different parts of the brain. And even just a plain MRI can tell us, if there's some volume loss in the hippocampus. So 7 hours of sleep is optimal, depending on who you talk to, 6 to 8 hours. Acutely, I mean, I don't know if you've ever had a night where you didn't sleep, but I know for me, all of this rings true. When I don't get enough sleep, I have more trouble finding words. I have more trouble, reasoning. I'm not as focused and attentive to things as I would like to be. And, that I don't know that my decision making is poor because of it, but I think that's maybe a little bit more long term. But, I think for some people it can be, we talk about how, you shouldn't get behind the wheel of a car if you're driving and you haven't had, 4 hours, at least 4 hours of sleep, just because our reaction time and our, all of those things that we take so for granted, because driving has become so unconscious for us because of that, lack of sleep, where the brain's not able to do things as well as it would normally do it.
Well, basically, when you're sleeping, it's when the body's repairing everything, right? So, it's healing things and, giving your brain time to rest and all that. Yeah, and I've definitely I feel like if I don't get enough sleep, whether I have had alcohol the night before or not, I honestly feel like I'm hungover the next day. Like I have
Yeah.
a headache. If I get, like, let's say less than, 5 hours or whatever,
Mhm.
I'm definitely a 8 to 9 hour person for sleep. And I know there's people that are like, nah, I don't, I get by on 4 or 5 hours or less or whatever. I'm like, okay, maybe, maybe you feel fine, but I find it, I don't know. I find it hard to believe that there's not still some negative effect to that of having not enough hours for that.
Yeah, I remember, I mean, that the studies basically showed that less than 7 hours of sleep per night was associated with increased morbidity and mortality. So, increased
Mhm.
disease risk and then death. So it is really important. And I think we don't give it, I know I don't give it enough of, I don't place it as important as it should be. I'm getting better at it, just because I'm, you know, I'm aware every day of the importance of it. But it's just, I always feel like I have so much to do, and I'm taking care of my patients and writing up my notes, and I've got all this stuff that I need to get done. And I have a life besides, being a physician. And so it's like I need more hours in the day, but we really do sacrifice our health when we don't get enough sleep.
Right. And I know you are doing a lot of research and study into meditation these days. And isn't it true that actually an hour of meditation can, now I don't know if it's the same thing as giving you back an hour of sleep, but I feel like you can do a lot of healing through meditation for people who maybe don't sleep as well or aren't getting as much sleep as they want or whatnot. If they meditate, that might counteract some of that.
Yeah, absolutely. I mean, it's been shown again to improve those neural connections, that neuroplasticity of the brain. It stimulates the hippocampus. It actually can increase the volume of that, the gray matter in that area. So it's going to improve memory and learning. So, there are also some studies showing that it actually increases the, and strengthens the prefrontal cortex. That's our decision making area of the brain. And it can decrease the amygdala. The amygdala is the part of the brain that is associated with processing emotions. So it basically just allows us to be less reactive, right? And able to pause and deal with the situation, instead of just constantly being, you know, react, react, react. So meditation, yeah, on so many levels is just so important. And I think too,
So,
you talked about mindset. It keeps
Mhm.
us mindful and grounded, and so we're able to have more of that positive mindset. And just like you want to put the right food in your body, you want to put the right thoughts in your brain.
Right. Yeah, exactly. So for people who are listening to this, so you practice in Connecticut and Florida, right?
Currently, just in Connecticut.
Okay.
Yeah.
So if someone who's listening to this would want to work with you or connect with you, how would they go about doing that?
Yeah, I'd say visiting the website would be great. If you're specifically interested in the cognitive decline piece, I would go to um, www.apollohealthco.com. And there you can take that cognitive assessment test. And, depending on your results, you can actually choose me as a practitioner. If you wanted to work with me there, you can also always call my office, 860-677-4600, and schedule an appointment with my office manager.
So that website was Apollo Health, like
A P O
Health.
L L O Health
Yep.
Co. Co. .com.
.com.
Yep.
Okay, that's awesome. That's awesome. Any other resources that you think people should know about? Any other books or tools or things, anything that you want in the last couple of minutes that you want to just let people know about?
Yeah, there's so many books out there. I mean, Dave Asprey has, Smarter, Not Harder. Dr. Perlmutter has written Green Brain. Gosh, there's so many books out there on brain health that are really helpful. And they each have their own kind of take and information. Dr. Bredesen's book I really love, and he puts in there all of the lab values that, the ranges that he considers adequate. So, you can read that, take that information to your provider and say, listen, I'm reading this book and it says, oh, my vitamin D level should be, this, and it's not, what can we do about it? I mean, some doctors will be open to it, some might not, but, I think just having the information and trying to find someone who, will partner with you in your healthcare is really important.
Right, exactly. Yeah. Yeah, I mean, and it's, I think there's a lot of one of the first things you mentioned before was hope. I think there's a lot of hope out there that we're starting to see that a lot of these things can be reversed.
Yes, and I think, as we talked about earlier in the show, the sooner you jump on these things. So when you start noticing, oh, I'm, having trouble finding this word, or I'm having trouble doing this math equation that I used to be able to do easily, it's time to kind of start looking into these things instead of waiting until you've already got a problem, because it's so much harder to reverse something rather than prevent it.
Yep, absolutely, for sure. But that's exciting. I mean, to me, brain health is so fascinating. I mean, just, if you start studying meditation or Deanna and I are huge fans of Dr. Joe Dispenza. He's a great resource for, whether you just follow him, read his books, do some of his meditations, or if you actually get to go to one of his events, they're completely life transforming for sure. But there's so much out there that's available to people, and it's exciting. And it's great that you're passionate about this, and as an MD, what you can do to help people as well. So I hope people will reach out to you again at your website, www.naturalhealthandhealing.net. And I want to thank you, Dr. Cherrone, for all the awesome information. This was a great show, and we appreciate everything that you're doing and all the information that you gave to us today.
Thank you, Diane. You're so welcome. It was great to be on the show.
Awesome, awesome. And I want to thank all of you for tuning in to the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific. Next time on the Dr. Diane Show, we discuss more about the power of thoughts and beliefs and the impact they have on your life. Have a great week, and I will see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.